Yes, this is Dr. Harshvardhan on this side, Union Health Minister from India. Am I talking to
Hello.
Olivier?
Yes, hello, Harsh.
Oh,
Nice to
yes,
meet
yes.
you, Mr. Minister, dear colleague. I think you're a doctor too.
Yes, thank you so much. I have been hearing for last few days that you wanted to talk to me, so I was waiting for your call only just now. So,
Yes, I'm sorry for that. It has been very difficult in France.
I know
The
that.
situation is very intense in France. But I'm really pleased to meet you, and I hope I will have the possibility to meet you in reality some days when we will have beaten the virus.
Yes, yes, of course. I know it is troubled times for the whole world, and France. I know, and Europe, America, everybody is in deep trouble. Yeah, yesterday also, I think you had lot of cases yesterday also. I think about over 2,000 cases yesterday also.
Yes, but the situation is a little bit decreasing. We have less people in intensive care, less people in hospitals, less people in city consultation, medical consultation, but it's very hard, very hard for the hospital. Imagine that there are today more than 6,000 people in intensive care, and normally in France we only have 500 beds in intensive care. So it's very intense in France, in all Europe.
So how are you managing these intensive care patients if you don't have that much of beds?
We have increased very quickly the number of beds. We improved our hospitals, and and it's a success for us because we haven't known the situation where you are obliged to refuse patients. It's not the situation in France because we were able to increase incredibly the number of beds and respiratory ventilators in the hospitals.
Okay, okay. So, how do you foresee the future right now?
We will try to stop the confinement in France progressively after the May 11th.
Yeah.
And we want to reopen schools in 1 month and to begin the deconfinement, as we call it in France. I don't know if it's exit strategy in 1 month approximately. This is the decision of Emmanuel Macron.
Okay.
So we are preparing ourselves to this situation because it's not easy.
Yes. So right now, is there a lockdown sort of thing there?
I'm sorry, I didn't.
Have you imposed some sort of a lockdown in the country right now?
Yes. The country is totally in lockdown. Totally in lockdown. Everybody has to stay home. Just possible to go to work.
Yes.
But everybody is yes. The confinement, the lockdown is in implication in France since 1 month approximately, and we are preparing ourselves with a politic with 3 main issues: massive tests,
Yes.
masks for everybody, and isolement of tracking and confinement of ill people.
So, what do you think? Means the people are cooperating. They are, in fact, respecting the principles of lockdown and social distancing.
Yes, the respect. I'm very surprised because I thought French people who wouldn't respect the lockdown, but it's real meant the case. We think that the reproduction factor
Yes.
of the virus
Yes.
is now under 1, approximately at 0.6. So it works.
So, how about the contact tracings and surveillance? Do you do all these things quite intensely?
We did it massively at the first days when it was possible to track every contamination chain.
Yes.
But since we are in mitigate, we don't do any more contact tracing. But after we stop the lockdown, we will have to practice massive contact tracing and to develop numeric issues to help us with the tracking, the kind of tracking.
And how about the treatment part now? What's the most popular treatment right now, or what is the drug that you are using right now for your critically ill patients?
We have initiated lots of clinical protocols.
Yes.
The bigger is called Discovery, including 3,000 people in hospitals in intensive care. And
yes.
we test remdesivir, we are testing hydroxychloroquine, we are testing antivirus, anti-EL6. We are testing few treatments, but nothing works at all at this moment.
Okay.
Maybe a little bit of plasma transfusion with plasma of immunized patients, but nothing works a lot. And for you?
You see, right now, in fact, we have not many patients are going into very critical situations. Though there are patients who are into ICUs and who are needing oxygen and ventilatory support. So, the routine drugs that are being used all over the world, and more particularly these days, people are talking about hydroxychloroquine as a prophylaxis for healthcare workers. So that's also being used for the healthcare workers. Otherwise, it's all mostly the supportive treatment. And then, of course, for some patients, we have used the antiretroviral drugs also. So right now, as you said, everything is like in the trial stage. People all over the world are trying different drugs, and we are also in a similar situation. But we are, I look after Science and Technology Ministry also, so we are actively working in that ministry also for some new things to emerge, whether it is for the drug discoveries or whether it is for vaccine development. We are also part of the WHO Solidarity Trial for vaccine development. We have also isolated the virus, and our scientists are working on all those things, and then for development of these kits for rapid testing, etc. We are now introducing the antibody testing thing also to just to see the extent of the problem in some of our hotspot areas. And but from the day one, in fact, we started responding to this whole thing on 8th of January itself, when 7th of January WHO had reported, China had reported to WHO about this coronavirus there. So on 8th January itself, I had called a meeting of our technical experts in my health ministry, and within a couple of days we had started giving detailed advisory to the country and all the states, and started community surveillance, also screening at our airports. Our first case was confirmed only on 30th of January, and but we had started our preparations much earlier. Now we are also under this lockdown. We completed first phase of the lockdown for 21 days, and now the second phase has also started. You must be aware of that. So we are, but in this second phase we are planning to sort of relax for some of the activities in some of the areas where we don't have cases. Right now, in half of the country, say it's of almost 350 districts out of some 700 odd districts in the country, we don't have a case. And in some 170 districts in the country, we call them as hotspots, where we have either cases ranging from 5 to over 15 and all, and there we have different strategies for containment for places where we have more than 15 cases, or for places where we have less than 15 cases, and there are some 200 districts in the country where we have just about 1 to 3 cases. So we have we right now know very well, I am sure you must also be in the similar situation, where the disease is, where our enemy is. So we are trying to use effective containment strategies, cluster containment, massive outbreak containment, home-to-home surveys and surveillance, and then all that is being done as best as possible. So, and we are keeping a close watch on everything. There are some 7 lakh people are under community surveillance. So the whole the whole country is geared up for the whole thing. Fortunately, we had some. Our average is 9 cases in the country per million population right now. So, so it's fortunately we are right now till now we are having a good quality control over the situation. We don't know about tomorrow. But we are trying our best to see that we don't leave any stone unturned. So that's what we are. But I would love to listen from you about what are the new things that France is doing. I know you are also in deep trouble, and yesterday also probably you had some. I was just looking at the WHO site, and that site showed me that you had some 1,400 deaths yesterday itself. Is that true?
Yes. It's true. We have some positive points. We have done a few transfers of patients in intensive care from an hospital to another.
Yes.
More than 600 patients were transferred from a region from another. Some of them were transported in a transborder country by train, sanitary train.
Yes.
It was the first time, I think, in the world, by airplane, helicopter, by boat, by road.
Yes.
It was very hard during 1 week. It was very hard because the number of patients admitted in intensive care was growing up very, very, very quickly. It was incredible.
Yes.
And then, because of the lockdown, this number began to decrease progressively. And so now we have today 1,000 patients less in intensive care than last week. So it's a good news for us. We are improving our policy of testing by deployment of high level PCR platform.
Yes.
To test more patients. Do you practice intensively testing in?
Yes, right. You see, right now we are also we are having a very well-defined, detailed criteria, and we are testing in the initial stages. We are testing all these people who came from outside, and then their contacts, and then all the cases of the acute respiratory distress and all, and then now in most of the hotspot and other areas, we are now testing every patient of ILI, influenza-like illness, who has some sort of a running nose and
how many tests do you practice in one day?
I think right now it's about over around 20,000 tests per day, but sometimes we test even more than that. And in the last 2-3 months, we developed our labs testing facilities. Earlier, we had one big facility in the country which was the National Institute of Virology in Pune. But now we have developed this testing facility for at about 230 places in the country, and we want to further expand it to over 300 places, and then expand our capacity. You see, yesterday our capacity to test in a day was something like 70,000 tests per day, but we want to expand it to a capacity of 1 lakh tests per day. So that's what, and then we are simultaneously starting this antibody testing also in our hotspot areas, hotspot districts, because that is a test. You know, you are yourself a doctor, a neurologist, and I know that that test doesn't give you a very critical direct evidence, but we are starting that also to aid the whole, you see, disease mitigation program. So that's how we are trying to handle the whole issue. I just wanted to know what are, like in this lockdown, what is that? What are those services that you have allowed in the country, and what's the system for people to sort of move out? Is it by some issuing of passes, or what is the way you handle that situation?
People is allowed to go outside of their home almost 1 hour a day. 1 hour a day.
Yes.
They can leave to buy some food or some drugs.
Yes.
They can leave to go to work.
Yes.
We ask for to develop teleworking.
Yes.
But if it's not possible, we allow people to go to work. It's very important because economic life must continue, but it's very hard. As you know, probably we have lost 6% of our interior brut product, so it's very hard economically for all Europe.
Yes.
But we ask people to go to work.
Yes.
We allow people to take transport like metropolitan, but people doesn't have the right to leave the city or their home. They doesn't have the right to meet each other. We
Yes.
have families are separated. All people are the most confined, even in medical hospital for all people, where they are confined in their room.
Yes.
They can't share any dinner, or they can't have any activity. So it's very hard for people, but they respect it. They respect it since 1 month. It's hard, but it works. It works because the reproduction factor is decreasing very quickly. So it's important that they understand why we do that. Okay. There's no discussion in the population. Almost everybody understand why we are doing that. They want more treatment. They want more masks. They want more tests. But they understand the reason why we put the country in lockdown.
Okay. So is there a ready plan to come out of the lockdown? How do we gradually sort of unwind the whole lockdown activities and bring back normalcy? So is there any future plan that you have devised right now?
The President Macron asked the government to work on it. We have 2 weeks to decide how we will do, and
yes.
In 1 month, on the 11th of May, we will reopen progressively schools, and we will reopen progressively with the country. We are deciding how we will do. It
yes.
depends of the epidemic profile and the situation when we will stop the lockdown. But it will be very progressive, and we will probably continue to confine all people and ill people because we want to protect this population. But we will reopen progressively. Other countries in Europe will do the same thing as we will do, like Germany, but they will do it, I think, one week before us. So we will progressively approach. We will have a progressive approach of the decrease of the confinement.
So, thank you. I'm sure you must be having all the support from your President, Honorable President Macron, and all your colleagues, because here in India also we are having all the blessings and support of our dynamic Prime Minister Shri Narendra Modi, and he is also monitoring everything very minutely, almost regularly, and is also leading from the front. He in fact gave a call to the country for a Janta curfew, and voluntarily people had participated in that. It's a country of 135 million, means billion, 1.35 billion people. So I'm sure President Macron must be very actively helping you, guiding you, and planning things for you also.
President Macron is very impressive because he reads everything, every scientific article, everything. He knows, he understands everything. It's very impressive to work with him. I think President Macron will send a letter to Modi in the next few days.
Okay. So just convey my respects to President Macron also, and my prayers for people all over the world, and in France also we are all praying to God that we should ultimately be able to handle this new virus, which we don't know which way it's going to go. I would just like to talk with you with an important challenge for us about a drug shortage. First, I want to thank you very, very, very sincerely because for your help in export of paracetamol. It was very important for us, and I want to thank you sincerely for that. We encounter problems with resuscitation drugs like midazolam. It's very hard for us to import this kind of drug, and we only have 2 weeks of drugs to treat patients, and after that we don't know how we will be able to save lives. And I just wanted to know, in this context, France has decided to adopt a new sourcing strategy by purchasing the most critical products at the national level. And in the sourcing, in this sourcing démarche, in the sourcing work, I wanted to know if India would be able to help us. No, I can promise that. You see, we have a very long-standing relationship, which is based on mutual, respect for each other, mutual love, affection, and admiration for each other. President Macron and Prime Minister Modi they are all good friends, and we'll certainly love to help you in whatever way we can. And I would like you to specifically send me in what way can India help France right now. You mentioned about drugs, and particularly any other thing that you feel that India can be of any help. We are not going to shirk away from our responsibility. We have always felt that the world is a one family, and we are all members of the one single family, whether we call ourselves different countries, but our thinking is such. So you just send me either a mail or something on what exactly can we do about which drug, and in what way we can be of help. We are going to plan everything with a very, very positive mind. That much I can assure you on my side. You need not.
Yes, I'd like to thank you very much for that, very, very sincerely, and we will send you as quick as we can the needs of critical drugs. I know our two countries share a very dense and ancient relationship in the field of health, with many actors involved, as underlined by our former Minister of Health during her visit in India in February.
Yes.
I would really enjoy to come and visit India and encounter you in one day when we'll be able to take plane another time.
Yes.
I really enjoy to discover India and to be able to work with you. We are both of us doctors, and I think it's like we say in France, a little clue to work correctly together. I want to thank you for that.
No, you are most welcome. I think we have to wait till this pandemic thing is over, but I would love to welcome you in India. Just when you come, you spend some good quality days or at least a few weeks here and just have a good look at India, and we can spend quality time together. And just convey my good wishes to the Science and Technology Minister also, because I look after Science and Technology Ministry as well as the Ministry of Earth Sciences and of course Health. We have many, you see, our relationship in all these fields is quite intense and quite strong. We have been exchanging so much of information, scientists and clinical and scientific work over the years now. So it's a very long standing in depth. I think it's a very great relationship. So we have to share the benefits of our achievements also.
Yes.
And in trouble.
And if one day you want to come and visit Paris, it will be a pleasure to introduce you. But I think you know France, no?
No, I don't. I have been to Paris once or twice, but I don't know French. I can only communicate in English basically. But I'm happy that you speak English so well. But I was only worried that if we have to talk to each other, whether it is through a translator or something. But I'm happy that you are a doctor, I know, because medicine all over the world, it's all studied in English. So
Yes.
we can talk to each other. I am an ENT surgeon by profession, and did very actively, practiced as a consultant ENT surgeon for many years, and then for last 26 years, although I continued with my practice also, but last 26 years I have been in public life, and
Yes.
I have continuously won 7 elections in a row, and but in between I keep in touch with my patients also. I'm sure you must also be doing that.
Well, 2 months ago, I wasn't minister yet, and I was practicing medicine in hospital. I was a deputy, but when I was deputy, I continued. I made the choice. I had the possibility at this time to continue to practice a little bit neurology because I'm a neurologist.
Yes,
but now it's done.
No, I read your profile. I know about you quite well, even though we may not have met, but I know about you.
Okay, thank you very much. It was a pleasure to talk to you. Thank you for your help. And I very hope we will be able to work together in the next few months and maybe years.
Yes.
And share together lots of things, because I think it's important for France and India to continue working together. And
Yes.
this pandemic shows how much is important.
Yes. And during this pandemic also, whenever necessary, we'll keep exchanging notes on how we try to do the best for our people in our respective countries. So we wish you all good luck, and I'm sure very soon you should have good quality success in handling COVID in your country. That's what we are wishing and praying for everyone. And once again, just convey my regards to your the young, dynamic President Macron. And,
I promise to tell him this afternoon. I think I'm going to see him this afternoon. I will tell him.
Okay.
Thank you very much.
Thank you. Welcome. We'll keep in touch. Thank you.
Okay. Ciao.
Bye.